I'm Dr. Kelly Starrett with H-Wave. When we have athletes or patients present with a painful or swollen hip, it can be really problematic. And you understand why, because we are designed to move and built to move. And suddenly the 5 to 8, 10,000 steps I'm normally taking a day, I'm reminded every single one of those steps that, wow, this is a really powerful and important weight-bearing joint, and that pain in this area certainly gets my attention. So we have a couple options here using H-Wave. Number one is that we can give ourselves some really incredible on-demand pain relief. Using the high frequency setting of the device, I'm able to put some energy through either hip and really give myself some on-demand pain relief. It literally makes it feel like someone has turned off that threat signal. And I can do that for many, an hour on, hour off, as long as I need, especially when I have some trauma in the joint itself, which is really sort of difficult to attack because the joint is so deep around so much musculature and connective tissue. So that's one mechanism, is that I can use this high frequency, run it through the joint on either side, and I can have some real comfort. And that we see that be very, very effective when people have hip replacements or they're having a labral repair or hip surgery. The next mechanism, which we love for hip surgery or hip trauma, is being able to use this decongestion device, use the decongestion setting on the H-Wave. And literally by using this low frequency, non-fatiguing muscle contraction, I can do a lot to decongest a swollen or painful hip. Now it's hard to compress this area. It's hard to elevate this area. And what we end up seeing is that most people end up just sort of sitting around hoping that the hip gets better. Especially if I'm on crutches and can't weight bear, it's hard to get enough muscle activation through the limb to actually do some meaningful decongestion. So we're always looking for, how can I move this movement system without irritating it or causing me discomfort or disrupting a trauma I'm trying to protect. So what we see is, well, I have the big muscle groups of the quads and the adductors and the hamstrings, even the glutes, and if I can create some non-fatiguing muscle contraction, I can get a lot of movement without a lot of motion in the limb or motion in the joint. So what's nice is that if I have an injury to the hip itself, that hip joint is actually drained by the deep lymphatic system. So there's no way that my kind of superficial muscles are going to sort of manage that with just some gravity. I'm going to have to actually activate those big muscles to actually pump out some of that congestion in the area. And if you've ever had a hip pointer, or you've torn a labrum or injured a labrum or just took a big shot on the hip, you know what I'm talking about. And a little effusion here can really throw off your back or make you feel a lot of discomfort. So getting some non-fatiguing muscle contraction involved with the system and recognizing that no matter where my trauma is on my hip, it's my glute or it's a hip flexor or it's a sort of attachment where some of the musculature is coming into the back here or even the hip joint, ultimately that thing is going to be draining out through the groin into the abdomen. So getting movement in this lymphatic system in and around the joint, upstream potentially at the glutes, downstream in the hamstrings or quads or adductors, can be very, very effective at helping me manage what is a very, very big system and potentially an area that can handle lots of swelling. This is a problem area for a lot of people after a contusion or trauma because there's just so much area for the swelling to sort of go to. If this commensurate amount of swelling happened in the hand, we would know our hand would be huge and we'd be on it, or even at the ankle. But here sometimes we can have a very congested tissue and we don't really have good mechanisms by which to manage that. It's hard to get sufficient compression. Again, it's hard to get elevation. And so what do we do? Well, in this situation, we can be pumping and decongesting. By putting pads on some of the musculature in and around the hip, we can do a lot to signal to the brain it's safe to move. We're going to move that tissue along. We're not going to have sort of some of the disuse atrophy or waiting around after these things. And of course, the combination of pumping plus managing with some high frequency pain modulation gives me a real sort of whole cart approach to making myself feel better and getting back to the things I love because I'm healing at the appropriate rate of a human being.